Hello, hi, welcome. Okay, today we are going to be talking about safe sex during COVID-19. So, some of y'all might be wondering, hey Maya, what is COVID-19? Because we totally don't know what it is because it's totally not affecting our everyday lives. Well, let's get into it. COVID-19 is a strain of coronavirus that was found in Wuhan, China in November of 2019. That is the reason why it has the number 19 at the end. The symptoms range from mild to severe and often include symptoms such as coughing and shortness of breath. So, if you notice you have either of those two symptoms, you might want to go to the doctor, sis. So the reason why we're talking about this topic today is because we're going back to school. Yes, we are. And that means that we, the younger group of people, these college students, yes, us, we are at higher risk because we're going to be in large groups living in dorms, and when you put a lot of horny young adults together, it's kind of hard for people to not have sex. So today we are going to be talking about how to prevent getting COVID-19 through sex. So in case you're wondering, yes, you can have safe sex during the COVID-19 pandemic. You can. Alright, so let's get into it. Number 1, before having sex, make sure that you're up to date on the latest potential risks of COVID-19 and how it spreads. So in case you already didn't know, COVID-19 can be spread through saliva, mucus, and people's breath, aka coughing. The virus has been found in semen and feces. Yes, it has been found in poop. Hence, we don't really know if it can be spread through vaginal or anal sex, but a lot of scientists think that it's very unlikely because most coronaviruses do not spread through sexual contact. So, we think we're good. We think we're safe. Number 2. Another great way to make sure that you do not get COVID-19 through sex is have sex only with people close to you. During the pandemic, you are your safest sex partner. Yes, that means masturbation. Masturbation is one of your safest bets. Just make sure to wash your hands and wash your sex toys for 20 seconds before and after usage. The next safest sex partner is someone you live with. During COVID-19, it's very important that you keep your social circle small. Have sex only with consenting partners. Maybe ask your partner if they would like to isolate with you in the same house, but that's a large commitment. We know, it's a very large commitment to move in with your partner during these times. Limit the amount of partners you have sex with outside of your household. If you do have sex with others outside of your household, have as few partners as possible and pick partners you trust. Talk about COVID-19 risk factors just as you would discuss PrEP, condoms, and other safe sex topics. Ask them about COVID-19 before you hook up. Good questions to ask are, do you have symptoms or have you had symptoms in the last 14 days? Have you been diagnosed using a nasal swab or a saliva test? People who have recovered from COVID-19 at least 10 days from the day their symptoms started and who have not had fever for at least 3 days are likely no longer infectious. So take note of that. And we're back. Sorry, I had to pause filming and then come back to it because I was getting distracted too much by my roommates. But anyways, let's go back, rewind a little bit. So, go by the saying, if 2 is company, then 3 is definitely a crowd. AKA, avoid groups of people. However, if you do find yourself in a crowd, limit your guests by keeping it intimate, go with a consistent sex partner, pick one more ventilated and larger place to have sex, and maybe experiment with wearing a mask. Who knows? You might find a new kink. So avoid touching your face and bring alcohol-based hand sanitizer. You want to be doing that, rubbing your hands with that sanitizer. Some of you may be asking, what if I meet my sex partners online or make a living by having sex? Well, you got some options here, sis. You could consider taking a break from in-person dates, or there are some online options including video dates, sexting, subscription-based fan platforms, OnlyFans, and sexy Zoom parties or chat rooms. However, if you still decide to have sex outside of your circle of contacts or a hookup, then ... closely monitor yourself for symptoms. Consider getting a swab or saliva test for COVID-19 on a more frequent basis. So monthly or within 5 to 7 days of a hookup. And maybe look for resources in Michigan on where to get tested. Also take precautions interacting with people at risk for severe COVID-19 illness, such as people over 65 or people with underlying health conditions. Also, wear a mask and use hand sanitizer often. Moving on to number 3. Having antibodies against the virus that causes COVID-19 or a prior positive diagnostic test does not mean definite immunity. Use test results with caution in helping you make decisions about sex. Number 4, take care during sex. Avoid kissing anyone who is not part of your close contacts of friends. Avoid things such as rimming, which could pass the virus to your mouth. We don't want that. Wear a mask or a face covering. You know, maybe it's your thing, maybe it's not, but during COVID-19, wearing a mask, covering your face, covering your nose, covering your mouth, that's a good way to add a layer of protection during sex. Also, it protects from heavy breathing and panting, which can spread the virus further. And if you or your partner have COVID-19 and don't know it, a mask can help stop that spread. And who knows, you may find out you have a new kink, like I said earlier. Some people like that. Maybe you do. But again, make it a little kinky. Be creative with sexual positions and physical barriers, like walls that allow sexual contact while preventing close face-to-face contact. Or masturbate together, but also use condoms. And also dental dams. And wash up before and after sex. Number 5, skip sex if you or your partner are not feeling well. This also includes skipping sex if you were exposed to someone with COVID-19 or if your partner has conditions that can lead to severe COVID-19 illness, such as asthma, heart disease, or diabetes. Number 6, I can't count. Number 6, prevent HIV, other sexually transmitted diseases / infections, and unattended pregnancy with condoms or other forms of contraceptives. Also, getting HIV self-testing kits is very helpful during this time. So if you have access to those, I recommend getting them. Number 7, be aware of where you are getting your information from and that it's accurate. That is very important because there's a lot of misinformation floating around the internet right now, and a lot of it is extremely inaccurate. I suggest CDC, the WHO. Yeah, those two mainly. Or Planned Parenthood. Planned Parenthood, great resource. I will link all these resources below that I used to make this video. If you have questions, I will be putting people's emails down below as resources. You can email them, asking them questions. How to get access to some of these things, such as condoms, other forms of contraceptives, and HIV self-testing kits, things like that. Also, I will try to put links down below on where to get tested for COVID-19 in Michigan and whether or not it's free. So check out those links below, folks, and I hope you have a great day. Have safe sex, use condoms, but most of all, stay healthy